In general, in patients that are still MRD positive, I would tend to favor continuing them on double therapy with Daratumumab and Lenalidomide rather than Lenalidomide alone. Certainly, especially if they have any high-risk features or high-risk chromosomes, but even just having MRD positive after treatment would be in favor. I would favor continuing the Dara. We have a couple different studies that looked at other studies that looked at Daratumumab and Lenalidomide after stem cell transplant. Both the Griffin and the Perseus studies, and they did those a little bit differently. In the Griffin, the Daratumumab was stopped even if they were MRD positive, and we did not see great outcomes in the double hit chromosome patients, for example, whereas in the Perseus study, that Daratumumab is continued as long as they're MRD positive. And so we're hoping that translates into longer term favorable outcomes for even the high risk patients.